Our doctors currently perform 3 types of bariatric surgeries. These surgeries are all clinically proven safe and effective in long-term weight loss. Each surgery has its own unique benefits, risks, and outcomes. So let's take a look at each one. Gastric banding, or the lap band.
The lap band is a restrictive device that acts like a belt. It goes around the upper portion of your stomach and allows you to eat less food and feel full.
After surgery, a lot of times for patients, when they eat small meals, they feel full for the first time. They've never really felt that full sensation. So eating fewer calories, they're able to lose weight, and they were never able to do that before because they were chronically hungry. The band itself is attached to some tubing, and that is attached to a port. And the port goes underneath the skin, under the fat, on the muscles of the abdominal wall. It allows us to put a special needle in that to adjust the band to make it either tighter or looser so that the patients get the right amount of what we call the restriction.
As you tighten it, you lose weight. You lose weight because you eat less calories, and you don't need to snack because when the lap band is adjusted appropriately, you feel full and can go between meals without feeling the need to snack.
After the lap band, the weight loss is slow. It tends to be about 1 or 2 pounds per week. So we usually tell people it's going to take them about 2 or 3 years to get down to their goal weight.
The average lap band patient by 3 years has lost 60 out of every 100 pounds that they're overweight.
All the operations have some risk, and as does surgery in general. With the lap band, although things can happen that require reoperation, it is exceedingly rare to have any problem that is a life-threatening sort of problem.
Now, the best part of having a lap band is its safety profile. It is simply the safest bariatric surgery there is.
We don't divide and reattach things. They don't really have the risk of a leak. You don't get malabsorption. You don't get dumping syndrome, which is something that can occur with the gastric bypass.
It's so much less invasive than all the other procedures. Most people go home from the hospital the same day they have the surgery, and most people are back to work within 2 or 3 days.
Lap band benefits. The lap band is the least invasive operation. It allows you to return to work quickly with shorter hospital stays. The lap band is adjustable and easily removed. It's also considered the safest bariatric procedure.
The biggest drawbacks for the lap band is the slower weight loss. It typically takes a person 3 to 5 years to lose their weight after the lap band, and the chance of slippage.
Well, some of the risks are things that can happen with any surgery. There are things like blood clots, pneumonias, infections of the wound. There are some things that are specific to lap bands. Probably the one that we hear about the most is a slip, and that's where if the band is on the top part of the stomach actually slips up above the band and blocks it off so that people aren't able to eat or drink. Another one that is heard about and occurs very infrequently is what's called an erosion, where the band actually erodes through the stomach wall into the inside of the stomach.
One of the most important things that a person has to do after they have a lap band is follow up with their physician. The average person needs to follow up in the office at least 6 to 8 times in the first year to be successful long-term with the lap band.
Adjustments are a really critical part of the lap band functioning. We talk about green, yellow, and red zones, and the goal is to be in the green zone where you're feeling satisfied with small portions and losing 1 or 2 pounds per week. People are way more scared of having it done than after they've had it. They said, "Is that it?" But what happens, patients come in, we clean off the area where the port is, and then we put a special needle in there. Sometimes we'll numb the skin up first. And I would say it hurts less than having an IV put in, so it's really pretty minimal.
Lap band drawbacks. Slower weight loss, frequent adjustment to achieve best results, risk of slippage and erosion. A 3-year study was performed involving 218 lap band patients with an average age of 44. The average starting BMI was 47.2. The average ending BMI was 31.
My name is Shelley. I had the lap band surgery, and I had it 6.5 years ago, and I'll be honest, if I had to do it again tomorrow, I wouldn't hesitate. It's one of the best things I ever did. It didn't save my life, it gave me my life back. There's something that happens to a woman's psyche when you can't lose weight and you think you can. You almost want to give up. And that's where I started realizing I was losing an emotional battle with my weight. And it was miserable. After researching the bypass, I knew I needed to do something. But it was too extreme for me. It works for many, many people. But I needed the help of my support person, so I chose to have the lap band surgery because it was something that was reversible, it was slower, it was less invasive. I still needed the same support person, I still needed to follow the same rules about exercise and nutrition, but it was something that was more tolerable to my lifestyle and to my support person. So that's why I chose the band. I've lost probably 85 pounds after the lap surgery, and I continue to tone up and look better all the time. And this is where I get teary about it because I know people's lives could be changed by having this surgery. It's not a cure-all, it's not a fix, and I'll fight anyone who says it's easy. It is not easy to lose weight. It's not easy to change your life, but it is so incredibly worth it. Sorry.